Hi guys, welcome to this edition of Comment Section Gossip with Autumn Flavin Florence. Today we talk about a nurse who lost her job because of a little advice she gave to a pregnant woman.
La dame en question, bon, j'essaie de conseiller la dame, j'essaie de rassurer la dame que bon, si c'est parce que le père a décidé de sortir, ça va et tout, il faut accepter et tout et tout et tout. Moi je ne savais rien. Et discrètement, donc je demande à la dame pour si ça te dérange autant, demande un second appui médical dans un autre hôpital. La dame, chose que la dame a fait, elle est partie demander un second appui médical dans un autre hôpital et heureusement pour elle, elle a pu accoucher par voie basse. Je ne sais pas ce qui s'est passé, je ne sais pas comment le boss a su que j'ai demandé à la dame de demander un second avis médical et c'est dans l'hôpital où elle est partie demander un second avis médical qu'elle a pu accoucher par voie basse. Ce matin très tôt, mon boss arrive
This pregnant woman has been visiting the hospital for antenatal for some months and she's due for delivery. When meeting the doctor told her she cannot give birth normally. She has to go through a CS. This woman was disturbed with the news, with the information of going through a CS. And she decided to meet this nurse who was on duty in the morning. And the nurse was like trying to advise her, trying to encourage her that the CS is not actually bad. If it is God's will that she gives birth to CS, there is no problem with it. She can actually go through it. There's no problem. And pray God, everything moves on smoothly. But this woman was so disturbed and she was like, I don't want to give birth through CS. I want to give birth through the normal way. This nurse decided to advise the woman, if you feel it's possible for you to give birth through the normal way, seek for medical advice in another clinic. Seek for another opinion, the opinion of another doctor from another clinic. And the lady decided to take this particular advice to seek for the opinion of another medical practitioner. She went to another clinic and sought for advice, and she was told that she could actually deliver normally. She could actually deliver through the normal process. And this woman, thanks be to God, she gave birth normally and she was happy. We don't know how the information got to the hospital where the nurse who advised her was working. And her boss, the doctor who had booked the woman for a CS, came to her saying that you have decided to remove food from my mouth by advising the patient, the client whom I had already booked for CS, to go to another hospital so that she can deliver normally. Since you have decided to remove this food from my mouth, you are going to pay for the money I had to gain, the benefit I had to gain from this woman. You are going to pay from your salary. I'm going to deduct it from your salary. And the nurse was like, if that's the case, if you're going to deduct money from my salary, it is better you pay me for the month. Let me go. And the doctor decided to pay her for the month. The doctor paid her for the month that she should leave and sacked her from her job. And this nurse decided to make this video calling on Cameroonians to help her so that she could get another job because she feels that she did nothing wrong in advising the woman to seek for another opinion elsewhere. And thank God for her advice, the woman gave birth normally without CS. She spent less and she did not go through the stress of after CS troubles. She says she's bleeding on Cameroonians to help her so that she can get another job because she is like the breadwinner of the family now. Since her husband had an accident and is down with sickness and she is the one taking care of the family, her husband and her children. She needs help to get another job because she sees that she did nothing wrong, but she lost her job because of one good advice she gave a lady, harmless advice she gave a lady because the lady was actually worried and the lady never wanted to go through a CS. Now let's get the opinion of those out there, how they feel about this particular story that this woman narrated on the video she made about her action that led to her losing her job. We don't know to say operation be so very common now these days. One mommy them be the born very well. Some of them be the even born for house without operation. Truly, these days, the rate of CS these days is too much. One goes to the hospital, wants to put to bed CS. You cannot put to bed normally. You cannot go through the normal process, the normal procedure. You must go through CS. it's becoming too much. Whereas in those days, it is difficult before you see a case of CS or operation, like we call it, for a woman who wants to give birth, who wants to deliver. But nowadays, CS here and there. Just because of her advice to the lady, someone will call her for a job that is more than that one. This other person is trying to encourage the lady that she can actually get a better job thanks to her advice, a good advice she gave, because they actually consider the advice a good one. Let's go to the next step. Because of her conscience, God will bless her with a better job. Not people then. This other person finds the clinic or the doctor in the clinic actions as an action of theft because they don't want to tell the patients or their customers or their clients the truth. They want to use CS because they know CS brings more money than the normal delivery. They want to use CS to make more money. I be the ever check say operation now the last option. The last option, no, but I was wrong. For most hospital now, it's now about money. Who stone we truly most hospitals now they think of money, they think of profit, they think of the benefit they will make out of CS because the least amount that they will get from the CS will be about 300,000 francs. So making 300,000 francs comparing to maybe 50,000 francs that's a patient or a pregnant woman will go through normal delivery. They see that it is better for them to go for 300,000 francs. So they always advise women to go for CS. They always propose CS. Even when the case is not that serious to be taken for CS, they will propose CS, which is bad. We need more nurses like her. Some hospitals now use operation as means of making money, not minding how it will affect the person financially. Truly, you see some persons struggling to even get maybe the 50,000 that they have to spend on normal delivery. Then boom, they go to the hospital and they are being told that they have to go through CS and they are asked 300,000 francs for deposit. I mean, it's just deposit. After that, you will spend more. Maybe you will see that you end up spending about 500,000 francs and they will be worried. Go borrowing here and there, borrowing money here and there, or asking for family members here and there, for help here and there, just to meet up with what they have been asked for CS, which is bad. Doctors, nurses, you should take pity on some of these women. If you should ask for CS, if you should request for a CS, it should be a genuine one. It should be that you have gone through all the options, you've seen that there is no other way, there's nothing you can do for that lady to give birth normally, then you can propose CS. Not proposing CS because of your personal benefits, because of the benefits the hospital will make. Please consider the woman's life, consider the woman's financial status, consider all those things before you go on asking a patient or asking pregnant women to go through CS. This is another comment we are going to take. I always like to advise the pregnant women that when you feel labor pain, pray and take the road to a clinic where they are not doing operation. They will try their best to see that you put to bed safely. If they see that you can't deliver normally, they will send you to where you can be operated. But with hospitals doing operation, they will not like that you deliver safely because they want money. So we see the notion, the ideas these doctors are putting into the minds, into the head, or into the minds of people. Look at the type of ideas that people are conceiving due to the issue of CS here and there, whereas the pregnant woman can actually deliver normally. Look at the ideas people are conceiving. This idea is not actually the best because I have witnessed a case where a woman had to go to a clinic where they cannot carry out CS. A woman needs to deliver in a clinic where CS is not being conducted there. And she was supposed to give birth to twins. The first child came out normally. The first child came out without any problem. But with the second child, there was a complication. And she was giving birth at about 3 a.m. At that time, where do we get a taxi? Where do we get someone that can quickly carry that woman to the next hospital, to a hospital where they can conduct CS? It was really very difficult. And she came to the hospital alone. So it was difficult trying to get someone who can come, who can assist them to take her to a hospital. It was really urgent, an urgent case. Trying to do all those things, the woman had to go 6 feet. The woman lost her life just like that, and with the other baby in her stomach. The woman died. The woman died just like that because she gave birth in a clinic where they could not carry upstairs. So there's also a disadvantage in giving birth in a clinic where they cannot carry upstairs, because if it goes complicated, maybe you will not be able to meet up with time moving to another hospital. For others, it is possible to move on to another hospital. But for other situations, it's so urgent that they will need to move on fast. And in the case of this woman, they needed urgent movement and they could not move at that time. She lost her life just like that. So we see the ideas that we are putting into the minds of many people because of the issue of CS, because we want to make money, we want to make much money fast. Please, doctors, if you should advise a pregnant woman to go for CS, if you should propose CS to a pregnant woman, then it should be genuine. It should not be because you want to make money. It should not be because you want to make much profit. But it should be because the woman cannot actually give birth through the normal procedure. It was nice having you for today's edition. See you in the next edition. Bye bye. We are waiting for your comments in the comment section.